Hello everyone, I am Dr. Rajesh, Medical Gastroenterologist, Sri Gokulam Hospital, Salem. In this video, we are going to discuss about the various causes of abdominal pain. The abdominal pain may be acute abdominal pain or chronic abdominal pain. Acute abdominal pain means short duration pain and it is severe pain lasting for only short duration. So chronic abdominal pain means it is lasting for long duration, probably a weeks or months together. So the pain, depending upon the location, it may be upper abdominal pain, it may be in the lower abdominal pain, or it be around the umbilical pain, or right side of the abdomen, or left side of the abdomen. So depending upon the site, the causes varies. So what are the causes? The common causes being peptic ulcer disease. In peptic ulcer disease, this manifests with upper abdominal pain or discomfort associated with food intake. The pain may be more after food intake or less after food intake. If the pain is more after food intake means it is a gastric ulcer. If it is less, the pain is reduced after taking food and it is more in hungry, means it is a duodenal ulcer pain. If it is a pain is more after taking food and it is associated with the regurgitation, retrosternal burn, chest burning sensation, it may be a esophagitis, that is GERD. So these are the peptic ulcer disease you can present. Sometimes gallstone disease can present with acute abdominal pain. Usually present with upper abdominal pain or right side abdominal pain, especially after taking a fatty meal or it's a heavy food. So it's usually severe pain lasting for half an hour or 1 hour so, and is associated with vomiting and sweating also. If it is acute appendicitis, it usually present with the first umbilical pain, then it goes to the right lower abdominal pain. It is usually associated with a fever and vomiting. Sometimes gastroenteritis, it is a large bowel infection, can present with acute abdominal pain and altered bowel habits. If it is a stone disease, kidney stone also can present with severe pain. This usually, depending upon the site, may be a right side or left side. If it is usually present with loin to groin pain, we call it the loin to groin pain as a ureteric colic, severe pain. It lasts for a few minutes to half an hour or so. It is usually associated with the dysuria or painful micturition, sometimes hematuria, blood in the urine. So these are the symptoms of renal stone disease. Sometimes gynecological causes, that is uterine causes or ovarian causes, can present with lower abdominal, central abdominal pain. So these and altered bowel habits can present with irritable bowel syndrome, long duration pain, altered with the frequent stools or constipation is very common among public. It is common called irritable bowel syndrome. So how to diagnose, what are the causes of pain? The basic test is ultrasound abdomen. By doing ultrasound, we can rule out gallstone disease, renal stone disease, uterine, ovarian pathology, appendicitis. Most of the abdominal conditions can be easily checked by doing a simple bedside ultrasound examination, which lasts for 5 to 10 minutes. It's very easy and available everywhere. If we suspect a peptic ulcer disease, then it requires an endoscopy. Again, it is a small, simple procedure which lasts for less than 5 minutes. We can know whether it is an ulcer is there, a peptic ulcer, or it is any malignancy is there in the upper GI tract. Suppose the patient has altered bowels, passing frequent stools, or it is a constipation, recent change in bowel habits associated with blood in the stools or lower abdominal pain, then this patient needs a colonoscopy. It's again is a small tube which passes through the anal canal, will examine the large bowel to look for any ulcers or any malignancies. So these are the tests by which we can diagnose the abdominal pain causes. Sometimes even all these investigations may not pick up. In that cases may require a CT scan. So these are the investigations for diagnosis of abdominal pain. By doing simple tests, we can conclude the diagnosis and treat accordingly. If it is a peptic ulcer disease, by giving drugs for 6 weeks, we can completely cure the peptic ulcer disease. Previously, commonly we do surgeries for peptic ulcer disease. With the advent of so many very good drugs, nowadays the percentage of surgeries in peptic ulcer is dramatically reduced. If it is a gallstone disease, if it is symptomatic, then this patient should undergo surgery for removal of the gallbladder. And if it is a ureteric stones, depending upon the size, small stones they pass naturally. If it is a big stone more than 5 mm, it may require endoscopic intervention to remove the stones. And gynec causes, depending upon the causes, may require a surgery or it's a medical management. So the important message I want to convey here is, if it is an abdominal pain, don't take it lightly. So do basic investigations like ultrasound, and if required, if you are advised by a medical gastroenterologist or your physician, undergo endoscopy. By doing this, we can avoid going for complications. And one more thing is prevention. How to prevent peptic ulcer disease is important thing is avoid unnecessary painkillers. This is the most important thing which produces peptic ulcer disease. And another thing is food habits. Junk foods, untimely foods, oily foods, you have to avoid and take fiber-rich fruits, vegetables, everything. By doing this, we can lead a healthy lifestyle without abdominal pain. Thank you.